Hello, my name is Dr. John Fischer, and I'm a plastic surgeon at the University of Pennsylvania Health System. I'm going to be speaking today about breast reconstruction. We know that breast reconstruction is a critical component of comprehensive breast cancer treatment, and it helps restore normalcy and femininity to women facing the challenge of breast cancer diagnosis. Of course, outcomes after breast reconstruction can be measured in different ways, and for the typical plastic surgeon, clinical outcomes matter a great deal, but also quality of life and satisfaction for our patients are equally, if not more important measures of success from breast reconstruction. Such measures are critical in helping us counsel our patients and in creating a multidimensional picture about what to expect through the process of breast reconstruction. Fortunately, we have tools such as the BreastQ, which is a validated or well-tested patient-reported outcome measure, effectively a tool that can help us really precisely understand what patients are experiencing and thinking and feeling before, during, and after surgery. And it has been extensively tested in breast surgery patients worldwide. We also know that the diagnosis of breast cancer can certainly physically and psychologically impact patients before undergoing their reconstructive procedure. Therefore, it is important to have normative data, that is, data from women who don't have a diagnosis of breast cancer, so that we can accurately compare the effects of both a cancer diagnosis as well as the effects of undergoing reconstructive surgery to really have the full spectrum of information to share with patients before, during, and after surgery. In a recent study by Klifto, published from the Johns Hopkins School of Medicine in Plastic and Reconstructive Surgery, they performed a study in which they prospectively compared 300 healthy control patients who don't have a diagnosis of breast cancer to 300 patients that were undergoing breast reconstruction. They looked at scores before and after surgery and across key different subgroups, including the type of reconstruction performed. They also looked at several important different domains or areas that might be relevant to patients undergoing treatment, including satisfaction with breasts, physical well-being of the chest and abdomen. On average, the breast cancer patient before surgery tends to have a lower breast satisfaction score as well as a lower physical well-being of the chest. Now, this information is useful to understand the impact of a preoperative diagnosis of breast cancer, but equally important is to understand what happens through treatment. Those patients undergoing reconstructive surgery had a significant improvement in several scores, and after breast reconstruction, satisfaction with breasts and psychosocial well-being were significantly higher in the reconstructive patients compared to the normal controls. And this provides very important information for patients and surgeons alike, highlighting the significant benefits of breast reconstruction. These effects were equally positive for both implant as well as autologous, or the patient's own tissue, reconstructive approaches, and they were noted at 1 year postoperatively. So what does this mean? This information provides very useful input to help guide decision-making for surgeons and patients alike. It helps both surgeons and patients make better decisions together about breast reconstruction, and it also helps us understand what baseline measures are important to consider and measure, and what results might be the best for each individual patient.